After 70, the hidden risks and silent diseases no one talks about. Growing old is often described as a blessing. You've seen decades pass, raised families, worked hard, and hopefully created memories that last a lifetime. But once you cross 70, life changes in subtle, and sometimes not so subtle ways. It's not just wrinkles or gray hair. It's the silent risks, the hidden illnesses, and the quiet decline that society rarely discusses. Most people think about aging in terms of visible problems: weaker muscles, slower walking, or forgetfulness. But what's happening inside the body is often more dangerous and largely invisible until it's too late. Let's explore these hidden risks step by step, because knowledge is the first line of defense. 1. The silent enemy: osteoporosis and fragile bones. One of the most underestimated health issues after 70 is bone weakness. Osteoporosis is called the silent thief because it robs bones of density without pain or obvious symptoms. A simple fall in the bathroom can turn into a hip fracture. Recovery from fractures is much harder after 70, and immobility often leads to other complications like blood clots or pneumonia. Most people don't realize that a hip fracture at this age can reduce life expectancy by years. Prevention requires vitamin D, calcium, and simple balance exercises. But because bones don't hurt until they break, this risk is often ignored. 2. Hidden in the heart: silent heart disease. Heart disease is still the #1 killer of older adults, but many heart problems remain hidden. Not every senior experiences chest pain during a heart attack. Some just feel tired, dizzy, or short of breath. Silent heart attacks are surprisingly common after 70. Irregular heartbeats, atrial fibrillation, often go unnoticed until they cause a stroke. What makes this risk terrifying is how subtle it can be. A person might just blame getting old for their fatigue, when in reality, their heart is struggling silently. 3. The unspoken risk of stroke. A stroke doesn't always start with dramatic paralysis or slurred speech. Sometimes older adults suffer mini-strokes, TIAs, that are brushed off as forgetfulness or temporary dizziness. These episodes are warnings of a much bigger, life-threatening stroke ahead. Because many seniors live alone, these warning signs often go unnoticed. By the time the major stroke hits, it's too late. 4. Silent kidney disease. The kidneys naturally weaken with age, but after 70, kidney disease often progresses without symptoms. Many seniors don't feel pain, nausea, or major issues until their kidneys are functioning at less than 20%. This silent decline increases the risk of heart disease, anemia, and bone weakness. It also makes medication management tricky since weak kidneys can't filter drugs properly. Routine checkups are vital, but sadly, many older adults skip them until it's too late. 5. Hidden dementia and cognitive decline. Everyone expects some memory loss with age, but what often goes undiscussed is how quietly dementia creeps in. Forgetting keys is normal. Forgetting the way home from a familiar street is not. Many families mistake early dementia signs for just old age. By the time they recognize it as Alzheimer's or another form of dementia, years of potential treatment and planning are lost. The silence around dementia often comes from stigma. Seniors may hide their struggles out of fear of losing independence. Families may avoid confronting it because they don't want to believe it. This silence only worsens the outcome. 6. The slow killer: diabetes in disguise. After 70, diabetes often shows up differently. Instead of extreme thirst or constant urination, seniors may simply feel tired, weak, or lose weight. Uncontrolled blood sugar damages blood vessels silently, leading to kidney failure, blindness, or amputations. Because many seniors already take multiple medications, diabetes management gets overlooked. What's worse, many older adults don't even know they have diabetes until they land in the hospital. 7. Hidden cancers that grow quietly. Certain cancers like pancreatic, colon, and ovarian cancers often grow silently for years. By the time they're discovered, treatment options are limited. Colon cancer can masquerade as constipation or mild stomach issues. Pancreatic cancer may just feel like vague back pain. Since cancer screenings are less frequent after 70, these silent killers often go undetected. 8. Depression and loneliness. The invisible disease. Not every disease is physical. After 70, depression becomes a silent epidemic. Many seniors lose spouses, friends, or independence. The loneliness creeps in quietly, often disguised as fatigue, disinterest, or irritability. Depression increases the risk of dementia, heart disease, and even early death. But seniors rarely admit they're depressed because they don't want to be a burden. This is one of the most under-discussed risks of aging, yet it impacts health as much as any physical disease. 9. Malnutrition and silent weight loss. You'd think food is the last problem after retirement, but malnutrition is shockingly common after 70. Taste buds weaken, appetite drops, and dental problems make chewing difficult. Seniors often eat less without realizing they're not getting enough protein or vitamins. This leads to muscle loss, frailty, and weakened immunity. Yet, because losing weight is often praised, many don't see it as a red flag. 10. Hidden lung problems. Even if you never smoked, lungs lose elasticity with age. Diseases like COPD and lung cancer can creep in silently. A persistent cough or shortness of breath may just be dismissed as old age, when in reality it's a sign of something serious. 11. Vision and hearing decline, more dangerous than you think. Most people think poor eyesight or hearing is just inconvenient, but the hidden danger is how it increases risks of falls, car accidents, and social isolation. Seniors with untreated hearing loss are more likely to develop dementia. Vision loss from glaucoma often happens without symptoms until major damage is done. The slow decline is easy to ignore, but the consequences can be life-changing. 12. The overlooked risk: medication side effects. After 70, most people take multiple medications, but here's the hidden danger. The body processes drugs more slowly, making side effects stronger. Dizziness, confusion, or stomach issues may just be medication overload, not aging. Many seniors end up in hospitals due to drug interactions they never saw coming. This polypharmacy problem is one of the most silent yet dangerous issues in elderly care. 13. The silent spread of infections. After 70, the immune system weakens. Infections don't always present with fever or pain. A urinary tract infection might just look like confusion. Pneumonia might only cause mild tiredness. These infections spread silently, and because they're not recognized quickly, they can turn deadly. 14. Falls, the domino effect. Falls are not just accidents, they're silent predictors of future decline. A single fall can lead to fractures, hospitalization, and permanent loss of independence. The fear of falling itself makes seniors less active, leading to faster muscle loss. Falls aren't just about balance, they're often linked to hidden issues like poor vision, weak bones, or medication side effects. 15. Sleep disorders and hidden fatigue. Insomnia, sleep apnea, and restless leg syndrome silently rob seniors of rest. Poor sleep doesn't just cause tiredness, it increases risks of memory loss, heart problems, and even early death. Sadly, many accept it as just old age instead of seeking help. The bottom line: why silence is deadly. After 70, the most dangerous risks are the ones no one talks about. They don't always cause pain. They don't always announce themselves with dramatic symptoms. Instead, they creep in quietly, disguised as just aging. But aging itself isn't the enemy. It's the silence around these hidden diseases. Talking openly about them, getting regular checkups, and paying attention to subtle changes can save years of life and independence. Aging may be inevitable, but suffering in silence doesn't have to be. Hit that subscribe button and join us on a journey through the timeless wisdom of the older generation. Don't miss a single life-changing lesson.